When a drug becomes very expensive, insurance requires a lot of additional information in order to approve the claim. And it's something that a doctor or nurse fills out manually. So our goal is to automate that process to make it easier and more seamless for both providers and for pharmacists. I became interested in the prescription workflows because my youngest brother was diagnosed with severe epilepsy, and it took about 18 months to get him onto therapy. So that was a very challenging period for our family, and he became very sick. And since we lived with fear that he would have this sort of permanent episode, I became very obsessed with understanding why is it that such patients who are so high risk that need certain medications have such challenges getting those medications and starting therapy. If you take a birth control script or a Z-Pak type of prescription, it's something a doctor would have written on a single piece of paper. Really easy to automate that. Specialty is much more dynamic, and so the information changes and it becomes much more challenging to automate that technology. And healthcare is a little bit behind the times in terms of technology adoption, and so there's been a gap in the space. We developed an algorithm or some logic that goes into the prescription process. So we look at specific insurances and specific drugs and the labels and say, this insurance, this drug, this is the information that's going to be required. And we pull that all in so that it's done automatically for the provider. So it really takes the guesswork out of what the doctors and nurses are doing today. And it goes from a create your own adventure process to being guided through which lab tests or which failed therapies a patient has taken before should be included in a specific prescription. We've been really excited about the results. We've launched in pulmonary arterial hypertension, which is an orphan condition. And we've actually been able to show that we reduce the overall time to fill by about 50% from where it stands today. And we've cut the amount of work that a doctor or nurse puts into the process down from about 20 minutes to about 90 seconds. We're adding to that category IPF as well as cystic fibrosis. And then we're going to expand beyond pulmonary into neurology and rheumatology. So there's been a lot of pull from other stakeholders. So it's not just the ease of use for the providers, but also other stakeholders like insurance companies and pharmacies that are now really yearning for better technology.